Welcome to the Performance Improvement Competencies Subgroup of the Core Competencies Workgroup call. This is Julie Sharp, Performance Improvement Specialist for the Public Health Foundation, and I will be facilitating our call today. Thank you all for your continued interest and support in the project to refine and develop a set of competencies for performance improvement professionals in public health. We are thrilled to have you all on the call today. And we would like to take a moment to thank our sponsor, the Centers for Disease Control and Prevention, for their support of this work. There we go. Just a few housekeeping notes, especially for those of you who are joining the subgroup call for the first time. You all are currently in listen-only mode. We hope that you're all going to have something to share with us on the call today. If you have not already done so and have the capacity to do it, please call in using the phone call option and enter your access code and audio PIN when you're prompted. When we come to the portion of our meeting where we want to hear from you, you just click on the raise hand button on your panel there. And let us know that you have something to share. We'll unmute your line and we'll be able to hear you. The handout section has these slides available to you. And then please use the questions panel to let us know if you have any issues with the technology. You can't access the audio component. You can also chat notes to us that way as well. We're going to be recording today's call and we'll make it available to you. We have a full agenda for our hour today, and it looks like there are about 14 of us joining in on today's call, so hi again to everybody. It looks like, let's see who's here with us today. We have Amanda Tyner, Bryn Manzella, Sherry Levinson, Cheryl Armstrong, Dan Ward, Diane Oye, Jesse Jones, Joe Kyle, Kelly Keenan, Kurt Koyama, Leni Simon, Liza Corso, Rand Tao, and Teresa Daub. So good morning to everybody. We are going to give you an update on where we are with the project. The last time that we talked, we discussed the literature review and what had come out of that. Today we'll be talking about the second part of the environmental scan report, which are the listening sessions that we conducted this spring. We're going to talk a little bit about where the environmental scan report is and plans to finalize it, as well as what we will be working on next year. As a reminder, our subgroup functions as a subgroup of the Council on Linkages between Academia and Public Health Practice, Core Competencies Workgroup. The Council seeks to improve performance of individuals and organizations within public health and represents 22 national public health organizations. Next, I'd like to give you an update on where we are with the project. So between February and May of this year, PHF conducted a series of listening sessions with performance improvement professionals. These listening sessions were designed to gather input from the field and used to supplement the information that was gathered during the literature review. Thanks to all of you who participated in a call, provided input via the online form, or did both. We had a really good response to both our calls and our online feedback form. You can see on the screen how much participation we had in each. We did do an in-person session at the Spring Open Forum. And then we had some good feedback from the online form. The online form closed on May 15th. We analyzed the information that was gathered, and we'll be sharing all of that later on in the call. This information, as well as the literature review, is being integrated into a final environmental scan report document, and that's going to be submitted to CDC by the end of this month. It's going to be a work in progress that's going to continue over into the next year, and I'll give you a little more information on what's happening there later on in the call. As I mentioned, we have received a great deal of information from PI professionals over the last 3 months, and we have been busy analyzing and summarizing that information. The input has been categorized into 4 major areas. First, the knowledge, skills, and abilities of PI professionals, the strengths of PI professionals as a discipline, the challenges for PI professionals, and what the needs are. So what I'm going to do next is kind of give you guys the rundown of what we found in the listening sessions with regard to those 4 categories. I apologize, this slide shouldn't say strengths of PI professionals, it should say knowledge, skills, and abilities, so we'll make an update to that for you all. While a wide range of knowledge, skills, and abilities, so KSAs, were identified as necessary by PI professionals, we found that a lot of them had common ties, and we could categorize them in a lot of situations. So we grouped together what we thought had the most logical connections, and then determined that we really had a top 10 categories of knowledge, skills, and abilities. And these are from highest to lowest. So for example, PI frameworks and methodologies was identified the most often. This category includes things like knowledge, skills, and abilities regarding Plan, Do, Check Act, Plan, Do, Study Act cycles, results-based accountability, Six Sigma, Lean, quality planning, quality assurance, quality improvement, the model for improvement, performance management system framework, or business process analysis. We also included in this knowledge about a wide range of quality improvement tools. The second kind of builds on the first. It's not just the knowledge of these frameworks and methodologies, but actually the application and selection of them as appropriate. So this, again, includes a wide range of QI tools and kind of assumes that that first one is met at least to a degree. Next, the concept of data literacy is something that came out in one of our listening sessions, and it may have been the listening session we did with this subgroup, but this is a concept that we really thought resonated well, and so we've created a category around it. It includes health data analytics, data and statistical analysis, data management, use of statistical software, databases and spreadsheets, performance measurement, knowledge of SMART methodology, and survey development, kind of all lumped together. The fourth is team management, which includes team building, group facilitation, ability to lead and participate in groups, relationship building, and alliance building. Next category is communication, which includes effective use of oral and written skills, as well as the ability to develop presentations and materials. Next is change management, which includes program and project management and effective organizational prioritization and problem-solving skills. Next is what we're calling PI advocacy. It includes a set of interpersonal skills to support the process. So we heard things like encouragement, optimism, compassion, empathy, resilience, and a belief in and value for PI, as well as the ability to overcome resistance, communicating value, conducting conflict management, negotiation, obtaining leadership buy-in and support, and employee recognition with regard to PI. Planning and assessment, which includes integration of PI into organizational plans such as CHA, CHIP, strategic plan, EOP, and workforce development plan. Also would include knowledge of the plans and their role in the organization. Number 9, workforce development, which includes the ability to coach, educate, and train others, understanding the needs and styles of adult learners, conducting train-the-trainer activities, development of curricula, integration of PI into the workforce development plan, and personal professional development relative to PI. And then finally, systems thinking, which includes having a full understanding of public health, population health, and the health organization at a systems level, recognizing how PI fits in and identifying opportunities to use PI. What we have in the blue box are other KSAs that were identified less often and may or may not have fit directly into the category. Some of them we felt kind of stood alone. These include evaluation, leadership, evidence-based practice, research, accreditation, fiscal stewardship, innovation, cultural competence, policy analysis, risk analysis, and patient safety. So what this is here is just kind of categorizing what we heard from the listening sessions. This is not by any way meant to be indicative of what the competencies would look like. Again, this information is going to influence the revision of the existing competencies in the next year. So I will stop talking for a moment and give you all an opportunity to process and share. I'd be really interested to know if this list looks good to you, if it resonates with you. Do you feel like the PI professionals we talked to captured everything? Did we categorize it appropriately? So I will give you a couple minutes, and again, if you'd like to share, you can use the raise hand button. You can also use the chat feature to send in your thoughts. All right, so we'll we'll see as things come in. We have more to share. Next, we asked people to share the collective strengths of PI professionals and of PI as a subdiscipline of public health. There were 5 major areas of strengths that were identified. First, PI respondents indicated that they feel like there's a growing body of evidence and data to demonstrate the benefits of performance improvement. As organizations have been implementing PI, they have found that resources begin to be freed up and positive momentum is achieved. Knowledge, skills, and abilities in PI have increased as well, not just with the person designated as the PI professional, but also in some cases across the organization. Number 2, the existing PI resources provide good support to the field, so resources such as PHKICS, PHPIN, Open Forum, some key PI professionals, and some partner organizations, and these have helped people learn how to implement PI. Number 3, another strength is an increased desire for and participation in the accreditation process has spurred growth in PI and provides a framework on getting started. Mandates for accreditation in some areas of the country, such as in Ohio, have motivated implementation of performance improvement and has increased requirements for accountability. Next, PI professionals are more than willing to engage in peer-to-peer sharing and find innovative ways to network. This networking is occurring both within and among public health organizations and also between public health and partners in the community, such as the link between public health and healthcare. The final strength that was identified is that the PI culture is flourishing. Respondents noted that implementation of PI has increased innovation and creativity, has broken down some long existing silos within public health organizations, has increased allowance of staff-driven changes and improvements, and has begun to reframe what was perceived as failure in organizations as opportunity for improvement. So would be interested to know if these strengths make sense, if you have other things that you didn't see there that you hoped we would see. It looks like we may have a question here, so bear with me for just a minute. So I did have a comment on the KSAs that accreditation framework can be embedded into many of these top 10 to better demonstrate the relationships and interaction between all of these. That's a great point. We've had a lot of discussion about the role of accreditation in PI, and I think what we've talked about too is accreditation is absolutely important, and we're big proponents of it. Do we want, I guess this is a question for all of you, is do we want to hang this on accreditation, or can can health departments work on this if they're not actively pursuing accreditation? And so we can obviously have more discussion on that. But I do agree that accreditation is going to be a key component, and we heard that in the strengths as well. Also had a comment that someone liked, oh, Joe, thanks, Joe. Joe liked this list very much. I can't think of any that should not be on the list. Workforce development systems thinking maybe could be more prioritized. And as we develop, refine the competencies, we can take that into consideration. I simply gave the list in order of most often identified to least often identified in the top 10. So accreditation actually didn't come up in the top 10. But as we categorize things, some things rose to the top. Okay, and Kelly has said it would be great to have this separate from accreditation as the accreditation coordinator at our agency. Thanks, Kelly. I think we all agree that accreditation is a key component to the work that's being done. And Liza has shared, as it relates to the connection with accreditation, there is accreditation overall, but also the work represented through many of the accreditation standards, including but not limited standards regarding QI and PM. Thanks, Liza. I agree. Thank you for sharing that. Okay, and please, as you think of things as we're going along, please feel free to send them in. I'm going to take a quick peek to see if we have any hands raised, and then I will move us along. It does not look like we have any hands raised currently. Okay, so I will move us along here. Okay. All right. We asked next for respondents to give us their feedback on what the challenges are for PI professionals and the discipline of PI. Many respondents indicated that education and training are major challenges. That came out more often than anything else, but that this particular challenge is multifaceted. So I've got 3 bullets there I'm going to describe a little bit more in detail. First, a new PI professional can find some free or low-cost training opportunities, but learning beyond the basics of PI can sometimes be difficult on one's own. The training that does exist is sometimes fragmented or siloed. There isn't one singular place to find everything. Many public health organizations do not have the resources to attend conferences and therefore can't stay as up to date on what's happening in PI. There's not currently a singular curriculum that promotes PI success, nor a singular place in which it is housed. Now, that being said, respondents did acknowledge the benefits of the TRAIN system, but indicated that some of the courses in TRAIN reroute to another website that requires additional login. So kind of going down that rabbit hole to try to get training accomplished. Next, when there is turnover in the PI professional position, many public health organizations struggle to find effective replacements that have the necessary knowledge, skills, and abilities for the position. Many of the PI professionals that were hired during initiatives like NIFI, for example, are no longer in those roles. And because training like NIFI isn't still ongoing, those training opportunities aren't really there for brand new PI staff. As a result, when you have a new PI professional come into your organization, there can sometimes be a steep learning curve for that person, which can cause the organization to lose some momentum in the area of PI. Finally, when you are trying to train your frontline staff about PI, there seems to be a pretty significant disparity in their knowledge, skills, and abilities with regard to PI. This causes challenge for the PI professional in terms of training those staff. This tends to be complicated with the use of technology, especially with some generational differences in use and understanding of the technology. This is challenged further when frontline staff and sometimes leadership don't understand the purpose of performance improvement, the benefits, and their role. So the PI professional is not only trying to train them on PI, but helping them understand why in the world they're doing this. So training and education is the first challenge. The next challenge is that developing a culture of PI is hard when frontline staff don't understand or are resistant to it, or they feel like they don't have time to do it. So that barrier it is difficult to overcome. This is even further challenging when leadership doesn't fully support the work. So if you've got a health officer who's really excited about PI and wants you to move forward, but mid-level management maybe isn't very excited about it, there can be that resistance to moving forward. Achieving full organizational buy-in is necessary for success, but removing barriers is challenging. It takes significant time and continuous effort on the part of the PI professional. PI professionals have to work with their colleagues to include PI during program planning instead of just as an afterthought. There is also some resistance to change the status quo and fear of negative consequences if PI efforts aren't successful. Many of the KSAs that were listed by respondents connect to this challenge, as respondents feel like PI professionals must be quite skilled with the challenges of developing a PI culture. So this is a big one for a lot of people, that they don't spend as much time implementing PI as trying to get everybody on board and continuing that culture growth. The third challenge kind of ties into that, but we felt like it needed to be teased out a little bit. Several of the people that we talked to felt like that PI professionals don't always have the authority they need to get the job done, especially when the PI professional functions in a non-leadership role, so in organizations where the health officer is engaged but mid-level management is not. The PI professional, again, has difficulty getting this implemented and spends a lot of time doing that. Next, because there is a lack of categorical funding for PI, respondents indicated that PI professionals often have difficulty advocating for it, especially when resources are already stretched. Some grant-funded initiatives have referenced QI, but respondents felt like they weren't really QI-focused in those cases. And while respondents indicated that effective PI can definitely free up resources and help streamline efforts, this has been a difficult sell in some situations. Finally, PI professionals identify difficulties with regard to data. Not only do they not always have easy access to the kind of data they need, in some cases it's not available at all. So for example, it's in closed systems the state has access to, but the locals do not. Or the data is restricted to program staff and PI professionals can't get access to it. When PI professionals have access to the data, some indicated they are challenged with how best to integrate it into their performance management system, how to develop that system from the get-go, and how to use data to develop appropriate metrics and how best to display the data. Because this is a challenge for them as PI professionals, they are similarly challenged with then how to best bring their colleagues along and make that connection for everybody else. So those were the major challenge areas that were identified. Would be interested to know thoughts from all of you on that as well. So from Joe, related to challenges is a lack of knowledge among leaders about what PI is, how to work with a PI professional. They need some minimum information to value PI and to know how best to work with PI professionals and the role of PI in improving organizational performance. Yeah, Joe, that's spot on, and it actually leads us into some of what we heard with regard to needs. I'll put that up on the screen and give the rest of you another minute to send in your thoughts with regard to strengths, challenges, or KSAs, anything else that you've heard so far. So moving into needs, this was the last question that we asked in our in-person session, in our virtual sessions, and in our online feedback form, we asked respondents to share what they need not only to overcome the identified challenges, but also then to meet a set of competencies once they're refined. We heard loud and clear from the community that a set of competencies alone is not really sufficient to meet the need. Supplemental materials and resources were going to be necessary to work with those competencies. So, these kind of build off some of those challenges. The first is need for training and professional development, including recommendations for developing a standard and vetted curriculum for PI professionals. Someone referenced the Public Health Improvement Certificate program that was at the University of Minnesota School of Public Health as an example. Respondents would like to see these trainings be more readily available in an online format or conference formats that are local or regional, and that they would be low cost enough to allow participation because travel and conference attendance is cost prohibitive for a lot of public health organizations. The recommended training topics aligned with many of the key knowledge, skills, and abilities areas that we identified, but included performance measurement, evaluation, team engagement and management, as well as opportunities to learn, train the trainer, so that they could bring those back and build some skills within their own health organizations. Joe, this next one kind of gets to your point, but the PI professionals also identified the need for guidance documents to support their work in PI. This included creating a guide for using the PI competencies once they're finalized, creating a guide for new PI professionals, something along the lines of how to become a great PI professional, and some guidebooks similar to the Michigan Public Health Institute's QI guidebook. Respondents also identified a need to develop a guidebook for leadership on how to work with PI professionals, and I think that value component that you referenced, Joe, may be a part of that. Sites that, like PHPN and PHKICS, have definitely increased networking opportunities. Respondents indicated that they wanted to see more opportunities to connect with fellow PI professionals. This would include not only increased utilization of PHPN and PHKICS, but also exploration of gap areas that aren't necessarily included in either of those, and creation of some other networking opportunities. PI professionals would also like to explore opportunities for in-person networking, perhaps through creation of regional collaboratives, in addition to already scheduled conferences. Similar to that, PI professionals would like to see an increased exchange of projects and work related to PI in order to reduce duplication and increase awareness of what is happening in the field. When pressed a little bit on that, respondents indicated it would be maybe broader than PHKICS, which focuses on QI projects, but go more broad into PI to include also performance management. Finally, PI professionals want to continue to see tools, particularly QI tools, published and provided to the field. In addition to that, the development of tools, finding a singular location in which these resources can be found was very appealing to respondents, and we heard that quite a bit. So although we identified, or the group identified, a number of challenges, they did have some ideas on how we could overcome those barriers. So that's what we heard. I'll take a minute and take a pause to see if there's anything else anyone thinks we need to add, delete, modify here, or if we're all pretty satisfied that this is representative of PI as a discipline and PI professionals as well. Okay. Remember, you can continue to send us your comments via the chat feature, or you can raise your hand if you'd like to talk and not just hear from me. It looks like we have a couple of people who say that things look like they're on target and hitting the mark. So thank you, Dan and Bryn, for that. And Sherry has said, oh, definitely on target. Okay, good. Well, that's exciting to hear that you guys are seeing things that resonate well with you and the work that you're doing. Thank you again for all of the information that you all have provided to us along the way. It's definitely helping to build a pretty robust environmental scan report. So I will step into that section of our agenda. So what we're doing right now is we're trying to finalize this environmental scan report. And again, it's got two major components, the literature review and the data from the listening sessions. We're integrating that together and drawing some conclusions. And it's really going to be used to guide the work of the project in the next year. Looks like we had a question come in. Bear with me just a moment. We had a question from Kirk. Was the idea of certification brought up? Kirk, there was some discussion about exploring a certification of some kind. I think that that's going to be in our environmental scan report, and I think it's something that we could explore going forward. As we move into the next year, we're really going to be working on getting these competencies finalized and fully vetted, and kind of see what comes organically out of that. But thank you for bringing that back to the forefront. Emmanuel has said, you probably mentioned this, what is the expectation on the guide for leadership on working with PI professionals? You know, Emmanuel, that's something that someone just has suggested as a possible document that could be created to supplement the competencies. I don't think at this point we would even have a framework for something like that. I think that if we decided to go in that direction in the future, we would be looking to the subgroup to give suggestions on what might be included in that and where we might want to focus. So stay tuned, I think is what I can say about that right now, and we'll see how this progresses. Thank you for your questions. So our project plan for the next year is going to be to take the results of this environmental scan report and use it to influence the refinement of the competencies. The first thing we're going to do is we're going to take this environmental scan report and crosswalk it against the current draft competencies to see where we hit the mark, where we missed the mark, where we need to add competencies, modify, delete, enhance, etc. Once that happens, we will be looking for this group to provide feedback on a revision, probably late summer. So stay tuned for that. I'll obviously, as we get a little closer, send out a doodle poll, and we can select a date that works best for everybody. Once we have that refined set of competencies done, we're going to conduct a very collaborative vetting process for that revised set of PI competencies. The results of that vetting process will be used to finalize the competencies, perhaps for a 3-year period, similar to what's done for the core competencies. Again, this subgroup will be asked to contribute to that vetting process and share feedback as we finalize the competencies. You know, we'll be looking to you all to disseminate some information on how people can contribute to the vetting process. You know, we may be asking for input at conferences and those kind of things. Once we finalize the competencies, we'll be promoting those to the field and then exploring how to create some of these resources and these support documents that would accompany the competencies. Can I Can I answer any questions for you all about what the plan is for next year? So I had a couple of comments come in. Joe has said CD Synergy, if I remember, had developed a primer for leadership on how to work with a social marketing professional. I think same concept could be applicable here possibly. Great, Joe. I will take a look at that. Thank you for letting me know about that. And is there discussion going on about this work here influencing the core competencies in addition to creating this more detailed set of competencies for professionals in the field? We haven't talked about how it might influence the core competencies. Those are going to be undergoing a revision process, and we work pretty closely with the team that's overseeing that. So I certainly see the opportunity for that synergy and looking at how these would influence, and especially as it relates to performance improvement competencies in the core. Liza has shared NACCHO also developed a document about advancing performance improvement broadly in local health departments. We should look at that to see how that fits with the question about leadership connecting with PI professionals. Thanks, Liza. Yeah, I think there are a lot of really good resources that focused on quality improvement and then kind of focused on performance management. Now that we have this new performance improvement concept, I think some of these foundational materials can be used as references as we bring this all together. You know, we at PHF, we have a performance management toolkit that we created. You know, there may be potential for bringing resources together that way under the performance improvement umbrella. So definitely a lot to explore, and I really love that that everyone is so engaged in that. And Joe has said possibly embed, particularly for Tier 2 and 3 staff for the core competencies, what minimum competencies they would need to work with PI professionals, for example. Okay, thanks for that, Joe. I think that's a good point. Yeah, we can definitely look at that as well. I love to see that people are connecting the dots here. That makes me really excited. Okay, so we're coming up on the end of the information that I have to share today. So I'll take it real slow in the event that people have more to share. But if you want to stay involved and know what's going on, obviously you're going to continue to hear from me as a member of the subgroup. If you don't already subscribe to the Council on Linkages update and PHF e-news, those links will connect you. You can email Janelle to get on the email list for Council on Linkages. That's going to give you the most up-to-date information as we put things out. You'll again hear from me. If you're like I am and kind of think of things after you get off of a webinar or a call, please feel free to email me. I love to hear from you all, and I know I got a lot of one-on-one conversation after our last call. So please continue to do that. I see this project as continuously improving, and we love to hear from all of you. So with that being said, that is all that I have to share with you all today. Thank you so much for your time and your thoughtful feedback on this. I'm really excited to hear that what we're sharing is resonating with all of you. I really look forward to sharing refined competencies with you toward the end of the summer and getting your initial gut reaction on all of that. I want to thank you all again for your commitment to this project. We definitely could not be doing this without all of you. And we look forward to speaking with you all again. So that concludes our call for today. Have a great day and a great weekend, and we will talk again soon. Bye-bye, everybody.